Co-founder and CEO Ankit Jain says healthcare AI today is a world of co-pilots. The next few years will be about agents. His company is using AI agents to automate everything from insurance approvals to patient follow-ups, and he joins us here on set. Ankit, thanks so much for your time. It's an industry that is really ripe for change because it's been stuck in the past seemingly for so long. What can you improve in terms of efficiencies in healthcare?
Well, first, thanks for having me. Healthcare is one of those industries that affects every single one of us, and we all want it to get better. We want it to get better for ourselves, for our loved ones, and it's terrible that when we're going through these healthcare journeys, we have to advocate for ourselves. We have to connect the dots between our doctors and our insurance companies and the support programs. And the opportunity for technology here is to connect those dots so that we can focus on healing ourselves.
There's this argument, and you see some of this in Capitol Hill with lawmakers trying to push back on allowing AI to be used in things like prior authorization, that you essentially just arm insurers with a tool to more quickly deny claims. And then maybe you have providers who are also using AI to try to fight the insurers. Does this just turn into an AI arms race between the two different parties at the end of the day?
We think about this as a bot war, or who's getting the best bots, and it's a constant cat and mouse race. What really needs to happen here is having a shared understanding, a shared language of what the requirements are so that the doctors can submit the right information in the way each insurance company needs. The complexity today is every insurance company has different requirements for the same disease states, for the same therapies, for the same procedures. That shouldn't exist. We should come together to understand what the medically and clinically appropriate approval requirements are for any therapy or procedure.
To Danny's point, these insurance companies are trying their hardest not to pay out, right? That's why the American public is so dissatisfied with health insurance. I had a motorcycle accident years ago, and it took me multiple years to resolve the insurance issues after a lengthy hospital stay. That's not because I was having trouble communicating with the insurance companies, because they were fighting as hard as they could not to pay for my treatment.
The reality is there's many patients that are going through the exact same journey you went through, and it's terrible that they have to go through this. On the other side, there's a set of folks that are overbilling, and AI is playing a big role in this as well. On the provider side, the companies that are giving the scribes that are enabling providers to not have to document something are now enabling upcoding and making sure that the hospitals and the doctors can get as much out of those insurance companies as well. So what we need to do is come together and make sure there's a good balance so that our insurance premiums don't go up because there's overpayment in the system as well.
What about cost? Because the common intuition is that you can trim costs. Our producer, though, Lee, dug up this study from PwC basically showing that costs were expected to spike by 9% by 2027, and 70% of those surveyed said that its use of AI documentation and billing tools as one of the top 3 drivers of cost. What about AI is adding to costs and not doing the opposite? Is just because compute is expensive right now?
And compute is getting increasingly expensive. As we think about AI models getting better, we're paying today not for outcomes, we're paying for machines to think. And we need to make that transition in the world of AI. Now, healthcare, surprisingly, has been thinking about this for a couple of decades. We've been thinking about paying for outcomes. There was this concept called relative value units, where you pay for the complexity of work, you pay for the outcomes rather than just for activity. And the world of AI needs to transition from paying for thinking to paying for outcomes.
Tell us about Eva.
So Eva is one of our AI agents that is able to help patients through these journeys, whether it is checking the status of a prior auth, explaining to a doctor's office what needs to happen to get that prior auth approved, or to help a patient understand what to expect at their next infusion, or to check in on the patient to see how they're doing. It's our set of AI agents that help connect those dots between the different
But Eva
groups.
is someone that I would deal with as a patient, someone that the doctor would deal with as the healthcare professional, or someone that the insurance company would deal with?
All of the above. We've got Eva facing patients and helping the patient understand what to expect, or checking in on the patient, understanding their medication regimen. On the other side, Eva is helping doctors' offices get those prior authorizations approved. And finally, EVA is helping insurance companies communicate more effectively with the providers as well.
For these large frontier models, it feels like all of a sudden it doesn't feel like it has been all of a sudden that politics has been injected into them. With the White House telling Anthropic your most advanced models can't be used abroad, so Anthropic says, okay, we're not going to offer them to anyone. As a business leader, how do you think about using these models if there is a risk that the switch can be turned off by the government now?
You know, like everything we've seen in technology, AI is now becoming a key part of the supply chain. So you have to look at it from a supply chain risk perspective. Can you switch from model A to model B? How much control do you have, and how much control do your vendors have, downstream vendors have, and make sure you have that ability to switch models at the drop of a pin, because some of these things are not in your control.
We have you have 98% of the payers that you work with, right? You have a massive chunk of the Fortune 500 companies that you're already working with. Does Infinitus become a de facto infrastructure layer in the sort of national healthcare model now?
You know, when we first started the company, I thought it was ridiculous that the way data exchanges hands today in healthcare is over phone calls and faxes. And our hope is over the coming years, we replace many of those back office phone calls with digital connections with each other so that data can exchange hands instantaneously, patients can get on therapy faster, the costs can come down. And that happens as we become part of the fabric of the healthcare system.